You're watching. When we come back, Dr. Janine Hubbard gives us her perspective on the All-Party Committee on Mental Health and Addictions. We'll talk to Janine right after this. Welcome back. You will remember last year when Tom Osborne was the Minister of Health, he and the government established an all-party committee in response to public outcry to address the surge in drug-related deaths. The all-party committee was formed to look at mental health and substance use, addiction services. That committee is now seeking public input. You can respond, engage. A questionnaire will be available online until August 2nd, and written submissions are also welcome. I assume if it's online, you're probably writing your answer, but that's just me being sarcastic. To talk about this and what these things really mean in terms of policy outcomes, Dr. Janine Hubbard, always a favored guest on this program with her insights on mental health and wellness and other things. Janine, how are you today?
Oh, always a pleasure chatting with you.
So
I'm having a bit of a sense of deja vu. I don't know how many people realize this is now our second all-party committee looking at mental health issues. I'm starting to realize I've been doing this for a while. I presented to that committee back in 2015, and they published their report back in 2017 with 54 recommendations and a 5-year timeline for them. I'm not sure how many people remember that process happening and then the various updates and the checklist and the report cards that came from it. But
how many of those 54 recommendations? How many of those 54 recommendations have been put in place, Janine? Just out of curiosity, do you know?
Well, if you look at the report card, they all have check marks. I think actually that would be one of my recommendations to the new committee is to really go back and revisit. Don't get me wrong. Some of them made enormous changes and they made them quickly, and we saw some amazing progress in a lot of areas. And then in some other areas, you know, maybe a little bit of it was accomplished, but the check mark's there. I'll just on a very basic level, for example, because one of the things I advocated for was enhanced insurance coverage for mental health for government employees. Because they have the insurance package for, your physio and your massage, but psychology coverage has historically been very, very low. That was one of the recommendations I made when I presented. It's in there as one of the 54 areas to explore. I think some areas have received that enhanced service, but not all government employees have received it. So those kind of examples. So just making sure that we don't assume that everything was accomplished in the last one, and or take a look at, well, what worked well and what didn't work. Because sometimes what we think is a really good idea and is going to solve an issue, when you actually get into it, you kind of go, no, that doesn't work. And also keeping in mind all of these recommendations were pre-COVID and the world has changed. So we have new needs and we perhaps have new things that we can take advantage of.
And as we have talked about, you and I, and as we've seen elsewhere, mental health challenges are broader and more complicated since COVID. I think it's fair to say you've set up the conversation nicely, and that is, look, we all know governments need to engage. That's a legitimate activity. Government should engage. Doesn't matter whether Liberal, PC, NDP, whatever, what have you. That's important. But my cynicism is always about, all right, the engagement's important, but how much of this in the past have you seen, at least in this sphere, that, yeah, they do the engagement, but the implementation, you've just given some examples of some things we're seeing progress, but the engagement is an excuse for implementation, and that implementation doesn't happen to the degree that we would all like it to happen.
Well, I mean, partly if we lived in an ideal world, everything would happen the way we planned in our own lives, let alone government. And this just an observation as a government outsider. I think what really drove the initial initiative, and it was one of the first of its kind in Canada, I'm really proud of our provincial politicians in this way, is it truly was an all-party committee. It was very much presented as nonpartisan. All of the parties were involved in the data collection and in the, helping to determine the priorities. naively, I guess maybe I thought I'd see more of that as it continued, as opposed to then it sounding more like a government report card of here's what the government has accomplished. And I'm sure logistically that is how it has to work. But making sure that that involvement from all parties, because if memory serves, the initial proposal actually came from our provincial NDP politicians at the time, but was really embraced by everyone. So there you go. That's why I'm not a politician and I don't work at Confederation Building or in Ottawa there. But I think continuing in that vein and not turning it into, an election issue, not turning it into a campaigning issue and saying, look, this is way more important than political posturing. The health and safety and well-being of our citizens is in dire danger in many cases, and we see new challenges present. So what I would say is, no, they're not going to do everything you suggest in your suggestions, but they can't make changes if they haven't heard from the public, if they haven't heard from the advocates, if they haven't spoken to the consumer groups and the frontline clinicians. So we don't often get this kind of opportunity. So I would really suggest, I actually completed the form this afternoon myself, partly because I just wanted to take a look at what it looked like. And it's a combination of kind of multiple choice, rank order, and definitely open answer sections to kind of respond to things. But it looks like there's also a section, if you want to write on behalf of either yourself or an organization and say, here are the priorities I see we need to address, or here are the gaps in services, even better, here are some suggestions for how we could address some of these things. Take the time. These are issues that affect all of us. They're important to all of us. Take the few minutes and give your 2 cents worth.
I know you have to run off in 3 minutes, so in 1 minute, if you don't mind sharing, what were the 3 priority issues for you wanted to see action on?
Oh, good question. For me, it's wait times. It's accessing appropriate services. And I just filled it in and I'm trying to remember what my third one was. Again, making sure that people have access at the right time to the right types of services, and making sure, of course, that services are inclusive. I think we've done a much better job over the last couple of years in terms of rural practice, but also understanding life in rural communities. That's something we're seeing as we have psychologists doing cross-jurisdictional practice more and more. And if you don't know what it's like to live in Happy Valley Goose Bay, and you're in downtown Toronto, you need to understand the unique circumstances. So while we physically can put people on a phone or a computer, we still need to understand the cultural differences and the geographic differences. And I think we're getting there for those.
All right, 1 word answer from you on this one, or more, up to you, but I will let you go after this, I promise. You talked about the 2015 report. We're now doing this again in 2024. Is it fair to say we have seen progress broadly in the way healthcare governments and their departments of health deal with mental health?
Oh, no question. There have been significant improvements since that initial report was released. Is it perfect? Not at all, but we have definitely seen some innovations. We've seen some focus. Some things have taken longer, but the report did produce some really useful changes in our services. So hopefully part 2 coming along now will continue to build on that model and continue to improve access and the right types of services for our citizens.
All right, and we got you off before 30. Janine Hubbard, thank you. Appreciate your input. Take care, my friend.
Oh, thanks, Tim. Anytime.
All right, that's Dr. Janine Hubbard. And as Janine said, if you're interested in this issue, make sure you do take time to fill out the online questionnaire. More engagement is important. When we come